Let's talk about enclomiphene again, because there's still a lot of confusion around it and a lot of clinics promoting it as a godsend. So enclomiphene will raise your testosterone on paper by stimulating what's called LH and FSH. For some men, they claim that it improves their symptoms for about 6 to 8 weeks, if that. Here's the issue. It rarely works long-term for true hormone optimization. The first reason why is because it doesn't fix the underlying issue. If your low testosterone is coming from insulin resistance, inflammation, poor sleep, excess body fat, thyroid dysfunction, or like chronic stress, enclomiphene is just going to push the signal. It doesn't fix the factory. Second reason why is that most people feel worse over time on this drug. It causes things like increased anxiety, mood swings, visual disturbances, and a lot of symptoms such as irritability. So it's really just forcing the system to raise the number instead of actually supporting it. Also, the testosterone numbers will go up on your labs, but your symptoms don't always improve. And it really doesn't improve free testosterone, and it affects your SHBG. The libido, energy, body composition, and mental clarity plateau, and most of the time it will get worse instead of better. What patients don't understand, and unfortunately a lot of clinicians that are unexperienced in this space but giving this out like candy, that if the problem is inside your testicles, the medicine enclomiphene will not work. Clinics are handing it out blindly without actually figuring out where the issue is causing the low testosterone in the first place. Enclomiphene can be useful in very specific cases and for very short term. For some people that want to maintain their fertility, or for short-term support of their testosterone, or really just as a diagnostic purpose, but it's not a use for long-term health optimization. If that's your goal for long-term health, preserving and building lean muscle, optimizing your metabolism, and actually improving your symptoms, not just chasing a lab number, enclomiphene as a monotherapy or only using enclomiphene will not work. That's why at our clinic we're focusing on identifying why a person's testosterone is low and building a sustainable plan, not just chasing lab numbers. For any personalized advice, reach out to us. Our goal is to help you look better, feel better, and perform better. Get started today.